to the next slide, Adriana. We're introducing, and we talked about this actually last month at HIMSS, and I'm excited to get a chance to double click on this, is CXA powered complex scheduling. So it's kind of a different approach to what you've seen with intent-based AI tools that have existed for about a decade, and just trying to open up as much self-scheduling as possible and running into some of those headwinds. Instead of treating it just as a single step transaction, we've got a team, a templatized team of AI agents to handle it as a real conversation. So one that you can gather the right information from the patient, apply your organization's rules, all of those different variables, and then make decisions dynamically. So as a patient engages with Autopilot or with an agent operating with Copilot, the system can understand whether they're new or established, apply referral specialty requirements, factor in things like provider availability and insurance paneling, and guide them through the right scheduling path end to end, as well as dynamically. So they can ask questions, they can update information that might be out of date in the EHR. And so the difference really is that the AI is operating with the logic that staff uses today. They pull that information in off the sticky note, they pull that information off of, call it traditional and non-traditional data and knowledge sources into the Talkdesk Data Cloud. We've talked a lot about where CXA gets its information from. We're bringing that much deeper into this specific specialty and diagnostic sort of scheduling workflow. It also works great for primary care, especially because we know that we can't always schedule every single type of new patient appointment for primary care. We're really trying to break more and more into that side. And so it's also, and I mentioned this a little bit, it's designed to work in that hybrid model that Adriana was talking about at the top of our webinar. The goal here is to really extend that staff so that when AI is handling more and more of these multi-step workflows, more of these appointment types, more specialties, more facilities, when it still truly requires a person to handle a patient that's got a lot of questions, we're talking about maybe really, really complex stuff that our organization just can't afford to ever think about automating, at least on the kind of maybe short and medium term. It's going to hand off to the staff member that's most appropriate with full context and not force those patients to have a complete reset to the conversation. So we want to help you scale without sacrificing quality or control for